Welcome back to Beyond the Clinic Walls. I'm your host, Roby Flynn, and today we have a very special episode, Beyond the Scan, the future of private radiology practices. Our goal is to explore common challenges and innovative solutions that apply across the board, especially when it comes to growth and efficiency. I'm absolutely thrilled today to introduce our guest, Anthony Dispenzier. He is the CEO of Reno Radiological Associates. Thank you so much for joining us.
Thank you for having me. Good to be here.
For our listeners who might not be familiar with your practice, could you give us a brief overview and your role there?
Absolutely. So we are a private radiology independent practice headquartered in Reno, Nevada, and we're about 25-ish radiologists, soon to be 6 nurse practitioners, and myself. We work to serve the broader Northern Nevada community in partnership with our health system, Renown Health, and really proud of what we do. And we have some really extremely talented physicians, a broad subspecialization from diagnostic, interventional, and neurointerventional radiology within our practice. And my role is to, as the CEO, to just sort of make sure that everyone's happy and working well and everything is going hopefully as smoothly as possible, given the constraints of what we're working with, and in concert with our healthcare partners to deliver the best healthcare to the patients in our community.
That's quite the role you've got there. From your perspective, working for this practice, what are some of the most significant hurdles you faced in terms of growth, provider acquisition, and operational efficiency?
Well, of course, in healthcare generally, but very specifically within the radiology industry these days, physician staffing shortage is really sort of the common problem that everyone's trying to navigate around. And so, first and foremost, we really are trying to manage that situation. And I think we've been pretty effective in doing so. I think we offer a pretty compelling place to want to work. Like I said, our physicians are extremely democratic. Everyone sort of gets along. It's a really nice working community. I sort of called it the Goldilocks zone of, small enough to really feel like a working group of folks, but large enough to be subspecialized and to really feel like a good working community of folks. And so my role within that, of course, is just to hopefully keep everyone happy and working productively to add more resources to continue to serve our growing population. The city of Reno and the surrounding area, we have a catchment basin of 100,000 square miles. And so it's a pretty large area between Salt Lake, Vegas, Sacramento, and it's a pretty broad area. And so and our area is growing pretty rapidly. It's kind of under the radar, has been for a long time, but I think it's one of the best outdoor areas in the country to live. Compared to the rest of the West Coast, it's got pretty low taxes and you're pretty close to everything and all the outdoor stuff. Skiing's only like 30 minutes away from here. And so it's a pretty appealing place to live, and it's been under the radar for a while because people like to think about Reno 911 and some of the joke aspects around it. But once you get here, you realize how great it is. And so for those reasons and others, our healthcare system is growing to help continue to serve our expanding region. And of course, our role within that is to make sure that we have the physicians to be able to serve our community. And so luckily, we've been able to add 5 or 6 physicians last year. We're on track to add probably 3 clinicians this year and hopefully more soon, plus a few next year. So in a market where so many others are struggling and really shrinking, in a lot of ways, we're actually growing moderately, but you have to grow intelligently. You can't sort of bite off more than you can chew, and we're really trying to protect our physicians and our quality of life and give them a world-class working experience because without that, they have so many options these days. They get 20 emails a day with new jobs, and so it's a difficult task, but that's the main focus. Of course, there's a broad variety of other things I'm working in, everything that's sort of non-clinical in our practice. I sort of have a role in, but that's if I were to pick one subject that probably everyone in our industry is struggling to manage, it's certainly shortage in physician staffing resources.
Perfect. In your opinions, what would be the benefits of working for a private practice versus a large hospital conglomerate?
Well, thank you for asking that question. I personally believe whether it's private equity you're working for, whether it's any large corporatization of medicine in general has certainly been a expanding trend, a trend associated with consolidation. I personally believe that independent practice of medicine has the right mix of incentives and pressures associated with the optimal experience for the physicians as well as optimizing things for the patient. So if you think about what a physician in independent practice would care about, right? They care about their own quality of life, how much they make, their vacation, their call, sort of all the stuff associated with their own beneficial circumstances, right? And being able to manage those as they are able to. And then they care about their patients, like the folks, their neighbors, the folks they see in the grocery store, their reputation, right? And so when you manage and operate, own your own business, you have direct control over your working circumstances. You can optimize the business in a way to maximize the return. Nobody's taking profit out of that business and before the return gets to you. And then of course it's your reputation on the line. And so as a patient, you're directly responsible for the patient. You're not sort of under this corporate umbrella like a private equity company or something like that, where well, so and so private equity company was operating this facility and I was harmed. No, it's literally the folks who are treating you that are that care the most about your personal care, and that's sort of the direct relationship. When you look at some of these corporate models, right? And I understand that certainly for running hospitals and other things, like a certain level of corporatization is not only I mean, it's necessary, right? I mean, if you're going to have these large institutions with all this equipment and such, I don't expect that every one of them is going to be privately, independently owned. But I would say, as a physician, if the market economics are favorable, I think that's the optimal way to practice medicine because you're in control of your own destiny. No one is, like obviously you've got to make partnerships and work, in concert with your health system partners, but ultimately you're responsible to yourself and the business. You don't have sort of corporate overlords telling you how to practice, saying, well, don't order that, order this instead because it's cheaper, or all of those other sort of conflicts of interest that come in when you have sort of a corporatization of medicine. And I personally think returning as much money to the doctors who own our business, and certainly treating the ones, even you don't even have to be an owner in this business, right? You could be an employee just the same. Obviously the expectations are different, but giving our employees the experience that they expect and deserve, and not changing the deal on them as private equity often does, or other interests. If you have, God forbid, you have a health insurance company that owns the hospital system and employs the doctors, so there's like vertical conflicts of interest throughout that entire relationship, so that ultimately the biggest problem in healthcare I see is a misalignment of interests, right? If you think about what private equity wants to do, they want to return fees to themselves, and then they want to return the rest of the profit they can take out of the business to their shareholders. Notice I didn't say physicians, I didn't say patients. And if you're not doing right by physicians or patients, or ideally both, as your primary responsibility, then I think you're doing the wrong thing in healthcare. And so I think that's fundamentally the problem with where we're at. And sort of the increasing corporatization of medicine is very much a bad thing for patients and for doctors, in my own personal belief. And so I think we offer an experience that's much different than that, much more beneficial for our physicians and ultimately for our patients. And so that's sort of the goal, is to keep that model available for those to really optimize those values. That's my personal belief.
Yeah, I would agree. I mean, if you can't take care of yourself and your peers around you first, then how can you be expected to take care of your patients when you'd have to be worried about a million other things at the same time? Shifting gears a little bit here, how do you find insurance companies affect your practice's ability to provide adequate?
Well, I would say that we generally have a pretty positive relationship with insurance companies these days. That's not necessarily the case for a lot of my colleagues around the country. If you followed anything around the IDR process, which is sort of the independent dispute resolution process around billing, for if you have a dispute with your carrier and you say, well, you're not paying me nearly enough money, which a lot of groups are, and they're going through the established legal process. Insurance companies are doing everything in their power to basically pay doctors as little as possible in other areas. Honestly, I think they're treating them very poorly. They're prioritizing their own interests and the interests of their shareholders over the interests of their patients. They're directly taking money out of the hands of doctors and worsening the care of so many patients nationally. And it's just a fundamental misalignment of interests. I'll give you an example. United Healthcare had a really bad year this year. They only made $12 billion because last year they made 24. And so, I mean, it was a really rough year for them. And they're so as a result, this is a large monolithic entity that owns hospitals that employs doctors. So that the conflicts of interest in this arrangement are ridiculous across the country. I mean, absolutely unacceptable in any other market. But unfortunately, in healthcare, because they have the lobbying power and they make the rules that they do, that it exists nonetheless. It exists to the harm of the patients and the physicians who serve those patients. In my belief, we have these. It's harmful to patients. Honestly, I mean, it's not if you're serving the corporate masters and you're not treating patients in the best way that you can, and you're taking so much profit out of the healthcare system in our country to sort of send it off to Wall Street. I mean, that money belongs in the healthcare system, helping to treat patients in a better way, investing in more equipment, technology, treating people better, and it's instead being shipped out, right? And so that's if I were to put my finger on one specific thing, I would say we've got oligopolies, monopolies in every state in the country with respect to health insurance. There's only one or two dominant payers in every single state. You sort of think, well, these companies have lots of competition. They really don't. It's an oligopoly system, and I personally think that we need to break up the insurance companies. Honestly, I mean, I think we're well past that. I think the problem exists in every industry in our country, frankly, and this is just one of those experiences. But when patients don't have options and there's not real market competition, we call ourselves a free market economy. I don't think it really exists currently in healthcare or in a lot of other aspects of our economy. And I think that is ultimately, fundamentally, what we're struggling with as a country. I know it's a pretty broad brush, but I believe that ultimately we need to bring back free market competition. And they're proactively preventing that from happening for all the obvious reasons. When you have, it's the golden rule. Whoever has all the gold makes the rules. And I think that's what you're seeing.
Yeah. I was fortunate enough to meet this amazing lady. She's actually a medical insurance advocacy lawyer, and we were talking briefly about the insurance companies and everything. United actually made more money this past year than all the other health insurance companies combined. And thank God for people like her, truthfully, for these struggling patients out there who are honestly taken advantage of by these massive conglomerate companies.
In so many ways, right? I mean, there's so many negative permutations from the current system, and unfortunately, like you can I mean, ultimately, where does the responsibility fall? I mean, obviously, the corporations are going to advocate for their best interest. The folks who make the rules ultimately are the ones who are finally responsible, but honestly, they have a pretty crappy job. If you think about the life of a congressman right now, for the most part, they spend most of their time financing, fundraising, flying back and forth between their districts, courting money to sort of run their campaigns, right? And then on the little bit of time they do have, often enough, they're voting on stuff they haven't even read yet. And the little information they get about it is generally provided by lobbyists. So big surprise that we're in the position we're in because the lobbyists, who has the most money to provide all this information? Well, primarily it's the health systems, the insurance companies, and private equity, right? The folks with, like I said, the golden rule, right? The physicians aren't the ones. I mean, you have these small, 20, 30 person physician groups. They're not the ones that are lobbying Congress and changing rules in their favor for all the obvious reasons. But those are the people, frankly, I think that more people should be listening to, or the people who work with them and understand this market and the problems that exist in it. So I'm hopeful that we can sort of, despite those challenges, I think the rule makers need to understand how we got here. I don't think either party has a monopoly on any good ideas on these in this particular part of the, and healthcare in general, because I think they're all listening to the wrong folks. And I don't think we really need some fundamental change in this market. I do look to folks like Mark Cuban, who's been speaking up lately about, how healthcare reform and certainly breaking up the insurance companies that are clear monopolies or oligopolies in this space, among other things. I mean, he's one who's been pointing out the obvious conflicts of interest that would be completely unacceptable in most other industries. And I give credit to those folks. I try to amplify that message for that reason.
Perfect. Going forward here, we're going to start diving into some technology, the lovely topic of AI, and some future trends. How has technology, particularly in recent years, impacted how you approach these challenges at Reno Radiological Associates?
Well, as you know, I mean, healthcare in AI and healthcare in particular tends to be well, any technology tends to be 20 years behind the curve for all the obvious reasons. You want things to fail in other areas before they fail in healthcare, so you'll kill people with new technology, right? And so, in some respects, the FDA and others have been appropriately shielding sort of the latest and greatest from coming about because there's good and bad associated with that, and we want to make sure it's fully vetted before it's implemented. We are using AI in our practice in a variety of different important ways. I do believe in concert with our health system partner, Renown Health, they have helped us to have the latest and greatest technology available for radiology, in my opinion. And those are really twofold. First and foremost, we have Rad AI, which is basically a radiologist. There's two main parts of a radiology work. There's sort of the report and the findings and the impression. If you sort of dictate the findings, we have a software that basically automatically uses the radiologist's previous work plus what they've indicated to auto-generate the impression, which means that they can sort of scan it and make sure that it's accurate, especially with critical findings, lots of different findings. It's actually quite good at making sure all of the elements are there, so it's kind of a second level quality check, as well as it saves them time from having to do so much dictation manual input, right? So that's sort of an efficiency gain, and we're actually working toward implementing the full software suite, which basically you just dictate into a box and it automatically generates the report and the impression, and the radiologist simply scans it to make sure that all of the correct elements are in there. It does measurements and other things, which a lot, it is it promises to save perhaps 20 or 30% efficiency. Right now, they say a radiologist only spends about 15% of their time industry wide actually interpreting images, which is really what they're getting paid to do, at least on the diagnostic side. And if we can increase that efficiency and have them spending less time doing grunt work and more time, helping more patients, that's a great thing for physicians. It's a great thing for patients, right? And then Renown is also the flagship hospital, or one of them at least, for AI Doc, which is an entire software platform of different AI. It could consider it sort of the app store of hospital AI tools, right? And so there's an app, if you will, for stroke detection. So there's a specific AI program that scans the images in the background looking for strokes. And if it finds one, it will bring it to the top of our work list to bring our attention to it. They do the same thing for pulmonary embolism. They do the same thing for vertebral fractures, extremity fracture, all these other sort of modules. And so what it's doing is it's just augmenting the physician's quality and trying to improve accuracy and quality by sort of a second level check and bringing appropriate things to physicians' attention. We have one for mammography and other areas, and all of those things are just sort of making the physician detection experience as they're working more positive. And so that's kind of those are the two main ways that AI is embedded in our practice right now. And I'm really excited that we're sort of on the forefront. I think at least when I talk to my colleagues in the radiology industry, I think we have a pretty compelling thing that a lot of physicians would find quite attractive. And I also think if you asked our physicians to go backwards and do without some of these tools, they wouldn't be very happy about it. So it's a good story.
That's great. So it sounds like you guys are using AI. You have a pretty positive outlook on it. What is your stance really on it and how it's affecting the healthcare industry and more specifically private practices?
Well, AI is a tool, right? I mean, I like to use this analogy that others have used before. I'm not sure if you're familiar with PACS. PACS is basically I remember I know you're in the industry, so you definitely understand it, but maybe your readers may not. It's sort of the picture archive that digitized all the images. Prior to PACS, we used to hang images, film on a light box and look at these fuzzy images to try to figure out what a patient might have for these scans. Now everything is digitized, so you have, hundreds of scans on a computer rather than dozens of scans or less that you're looking at. You can look at them a lot more efficiently. And I would tell you before PACS, all the radiologists were like, am I going to still have a job after PACS? I'm concerned that if everybody has access to these images, they won't need me anymore. Well, fast forward 20 years, and guess what? There were physicians working before PACS, and we need a lot more radiologists after PACS. So what happened? Things got more complicated. Now, instead of a head CT having 37 images, it's 400 or 500 images. And so there's a lot more work to do. The resolution is a lot more refined and improved so you can see a lot more. And so there's actually more work to be done now rather than less. And so in the same vein, AI is a tool. It's very good at playing Where's Waldo. It's not so good at the same children's game where the dog is on top of the house and any 3-year old can tell you, hey, that's not right. But the AI struggles with that because it has no cognition. And so it's good at certain things, bad at other things. I think it'll be a helpful tool to hopefully make us be more efficient and do more work and help more people. That's sort of the promise of AI. And frankly, with the staffing concerns we have as an industry, we need it just to keep floating, right, and not drown in the work that we have. And so I think there will be radiologists before AI, and then afterward, I think there will be radiologists working and using AI. And I think that is going to be beneficial to radiologists and patients. Right now, it's not even functioning like a resident, let alone a fellow. And so, what does that mean? We want AI to do all the grunt work so that the doctors can focus on sort of the more complicated, complex stuff that really demands and requires their attention. And if we can get to a better place where the AI does more of the grunt work and the doctors can focus more on some of the complicated stuff, I think generally that's a good thing. So that's where we're headed.
Yeah. I think AI is, people look at it as almost a replacement to the job, but I see it, there's kind of two sides to every coin, right? I think it's going to replace a lot of things people do on a daily basis, but at the same time, if it can streamline a lot more people coming through, you're still going to have that human aspect of the job that has to be there. Some other countries, they're very backed up in terms of their healthcare. It takes months, if not years, to be seen by some specialists. So hopefully that'll help streamline some more people to be able to get the care they need to get before it gets to horrible stages like in cancer, for instance.
Well, to that exact point, AI is better than having no doctor, right? In the US, hopefully, I don't think we get to the point anytime soon where AI is reading scans independently. I think that's sort of a dangerous place to be. I mean, AI has hallucinations and other stuff, and there's risk around that. But if you're in a third world country and you don't have access to a radiologist, if you can get a scan and have, AI read it and tell you more than likely than not, this is what's going on, that's better than nothing. And so I think there are places in which you'll already see it starting to be read. I think the UK in particular is struggling with radiology staffing per capita. Everybody is, but they're struggling the worst, I think, of a lot of the developed countries. And so I think you might see them start to read some of the basic X-ray stuff that's so backlogged that it's better than nothing. Like you're getting to that point in some of the countries, and that's not necessarily a good thing, right? I mean, that's a resource limitation combined with you're working with what you've got. And that's kind of where we're at in some of these places. Thankfully, not in our practice or in the US. But as things progress, if we continue to see degradation of the physician experience and have more people leave, if if we don't treat our doctors well, you may very well see that more of that here. I mean, ultimately, is it possible that they replace people? Yeah, I maybe. I don't know. I don't think it's going to happen anytime soon. They predicted famously that was going to happen in 2015, and a whole bunch of people didn't go into radiology as a result. And now we got a huge shortage. So I mean, I don't think it's a wise thing to predict. I don't think it's. I mean, hell, they can replace any industry just the same. I mean, radiology is probably no different. But up until that point where they do, we still need plenty of people doing the work that we have, and there's lots of work to be done. And so I wouldn't discourage anybody from going into it. I think it's a noble profession. I think they're probably some of the most comprehensively educated physicians that exist, because if you think about what a radiologist does, most of them, at least a lot of them, are generalists that read everything. I mean, from the tip of your head to the tip of your toe. I mean, right? They know all of the aspects of what they're looking at, and it's a pretty. They're not the first physicians you probably think about when you go into the ER and you're thinking about interacting in the healthcare system, but I think they're, along with them and pathology, probably one of the most broadly, probably hits the most number of patients in the health system. So, anyway.
I mean, without radiologists, there's no diagnosis, truly.
Well, they call this is probably unfortunate, they call the CT scanner the donut of wisdom. And the way that they train people these days, unfortunately, there are a lot less. There are nurse practitioners replacing ER docs in certain states in this country. And Guess what? They're not well trained compared to a physician, and they often don't know what the hell they're looking at. And so when the answer is, I don't know, everybody orders imaging. And so that's why imaging volumes go like this, because if you have people that are not trained properly, or overwhelmed and don't have the time or ability training whatever to diagnose properly, you get more imaging, and that's kind of the it's almost it's practice insurance for folks on the front line to say, well, it could be this, but let's check with a CT scan, right? And now, are there folks out there that are ordering stroke workups on 20-year-olds in the ER because they have a headache? Yes. And is that wildly inappropriate? Yes. And we're hoping to reduce those kinds of things in particular because that's not good for patients. It's not good for the health system to do things like that. But that's sort of the battle that we're fighting, is using it, at least in some respects, as practice insurance. And certainly, we're working with what we've got. We get a lot more imaging. So that's kind of how it's been working lately, at least industry wide. I don't want to cast aspersions on our own health system partners. The ER group and our group in our area is fantastic that we work with. But I'm speaking broadly and nationally about some of the trends you're seeing and the way things are going. I mean, the statistics demonstrate that this is just sort of what we're experiencing as an industry.
Any words of advice you have for medical students out there, young radiologists, owners, leaders in the private practice industry, that anything on navigating growth, embracing new technology, and just focusing on what truly matters?
Well, those are pretty broad and disparate groups of people. So I would say let's break that down a little bit. To the folks in my role, I think, and everybody kind of is already working with this, probably knows it intrinsically, but you really have to, growth is not the goal, right? In a market like this, where you can throw a rock and hit 20 facilities that could use your help, right? Growth, growth, is secondary to physician staffing resources and keeping your doctors happy. That's number one, number two, and number three probably for us, right? And trying to attract more people to your practice to continue to perform your mission. That's where people in our area are focused. I've seen people get in trouble where they sort of as a group bite off more than they can chew, and then the doctors and the practitioners are like, hey, that's not what I wanted or signed up for. I'm out of here. Like that's a risk, right? So really, you've got to manage growth intelligently and make sure that you're working with the resources you have and not burning them out. I mean, that's really where we're at as an industry. So more than that, that's sort of the main focus of folks in my role right now. And then beyond that, to medical students and people who are considering this as a practice, they're highly trained in academics, right? I mean, that's the experience they've had in training to date. And so they know what academics is like and that sort of thing, the environment and that sort of thing. They probably have a lot less exposure to independent practice and other models of practicing medicine, whether it's working as an employee in a large health system, or it's working for private equity, or God forbid, working for a hospital system that's owned by a large multinational health insurer with some of those conflicts of interest we were talking about earlier. And really, what I would encourage them to do is reach out to people like myself and others, really get an understanding for some of the groups, the dynamics of the market that you're going to be working in. Ask good questions. I and other people are available to try to help. I tell people that my job is to help physicians make better decisions. I usually do that primarily for the ones who I'm working with and who pay me, but it's a more broadly appropriate thing that, if people are coming to me asking for help, I'm going to try to give them the best guidance I have about how to navigate the market and try to find the best job for them. But you've got to consider things. I see so many people that are considering, well, I just want the highest dollar per work RVU in our industry, for example. And if you think about that, the most desperate groups are going to have the absolute highest rates, right? I'm not saying don't seek a high price for your services. Make sure you're paid and compensated fairly, right? But if they're that desperate, desperation is driving this market. There's a reason, right? And so think about that. Think about the actual business that you ultimately be working in, or perhaps if you want to be owning, right? What does that business look like? What's the future longevity of it? What are their health system partners that you'd be working with? Like, understand the model, how it makes money, where the opportunity is. Like, you've got to really sort of dig in and understand that identical looking practices can be very different. A lot of it has to do with corporate culture and the people that work in that business, right? The other owners, are they crazy? And Other factors like that is the health system relationship that you're working with good? Or if you own imaging centers, are the fundamentals of that business good? Is it complicated, difficult to manage in a way that takes a lot of time, effort, resources, overhead, that maybe in a business like ours you could be making the same or better money and not have all those headaches, right? And so there are a lot of things to consider. I'm happy to help if folks would like to reach out and ask me questions. I'll do my best as I often do. I've spoken with folks in residency who are in that position of thinking about their next job and trying to give them the right tools, ask the right questions, and be curious about enough to figure out what you need to know and do yourself and your own future career, the right service by. I would say not joining a private equity group. I would tell any, if you think about what their private equity is trying to do and your own personal goals and attributions. I mean, I would say first and foremost, that's generally everyone's found that to be a horrible trade for all the obvious reasons. And I can explain those further, but that's a whole separate podcast.
Where can these people reach out to you? These young residents, people looking to find a new practice. I mean, after they hear this podcast, it'd be crazy not to want to come work with you.
Well, appreciate that. I'm primarily just on LinkedIn. That's the easiest way to find us. We do have a website, but honestly, we don't put almost everybody that hits our website is looking for patient billing. And so we really try to direct them to the billing resources, not so much to us personally for that reason. And so really, if you find me on LinkedIn, I have one of the most unique names on that platform probably. And so there's not too many of us. You'll look for the bald guy with the beard and you'll probably find me.
Perfect. Thank you so much, Anthony, for your time today.
Thank you so much. I appreciate the opportunity to chat with you, and thanks to all your listeners for making it all the way through. And thanks.
And to our listeners, I hope this conversation with Anthony has given you some fresh perspective on how medical private practices operate across different specialties, how they tackle common challenges and embrace innovation for growth. Whether it's through advanced imaging or AI-driven patient acquisition, the core principles of efficiency, patient experience, and strategic growth remain paramount. Thank you so much, Anthony. Take care, okay?